Good morning, good evening, aloha, and namaste. Uh, Nice to have everyone here. Uh, Bit of housekeeping to begin. Your hydration station is out to the left as you pass the overwhelm, going towards orientation. That is dry. No, that is dry. Let's talk about you for a moment. Not your patients, not the guidelines. Let's talk about you. Think about a day on placement where you finished your shift. You realized you barely had anything to drink. You grabbed maybe a quick coffee. Maybe you had a few sips of water between your tasks. You get home, you've got that pounding headache. Yeah. You stand up, you're a little bit lightheaded, mouth is dry, thoughts are just a bit slower. Your body is telling you something very simple. I'm underfilled. I need fluid. Think about a different day where you had a salty food late night. Mm, Hardly slept, spent the next morning feeling all swollen up. What else would describe a nice late night salty meal? Yeah, anyways. Yeah. Any rings fit tighter, shoes feel a bit snug. Well, your body is basically saying, I'm holding on to more fluid than I really want to be. So imagine understanding this fluid balance as it occurs to you. How can we deal with the context of how your patients might be feeling? So, we're going to look at your own system, and even if you don't use it in the same words that I've used, let's look at fluid balance, some of the physics that are operating there, and how this affects your patients and their own context of care. The same basic physics is operating, as I've said. The difference is that many of them have hearts and kidneys and blood pressure systems that can't adapt as easily as yours can. When you're dehydrated, your blood pressure might dip a little bit when you stand up. Your heart and the vessels compensate. When you're a little bit overloaded after a salty meal, given enough time and rest, your kidneys will sort it out. If your patient has heart failure, their heart cannot ramp up in the same way. If they have chronic kidney disease, their kidneys cannot clear the extra salt and water efficiently. If they have diabetes and vascular disease, their circulation is already under strain. That's why fluids are such a big deal in your patients. The margin for error is tiny. I'm telling you this because I want you to normalize something that's very important. If you ever sit back in the lectures that are about fluid compartments, crystalloids, colloids, osmolarity, and you felt your brain just sliding off the page, it's not because of the difficulty of understanding fluids. You live a fluid balance every day in your own body. Pay attention, put it into context for yourself, and the ideas behind the learning will really sit nicely. You already know what it feels like to be dry, to be overloaded, to be dizzy, to have a racing heart from too much caffeine or too little sleep. What you have not been given yet is a clear way of connecting these into a map that helps you work through that system as you're on the ward, as you're moving through your shifts. Trying to remember if I was going to tell you something else. No, let's just carry on from there. We're going to talk about being on the ward under pressure and dealing with IV fluids as a first year, and perhaps even at other times you find the context you'd like to apply this to. Um, you have IV conversations. You have separate sessions of learning that are focused on the organs and their functions. You might have sessions on heart failure, on kidney disease. You'll have an orientation on fluid balance charts. Then on the ward, all of a sudden, you have everything wrapped up into one. And the message given to you is you'll get the hang of it. Yes, you will. Work hard at it, and you will. Preceptors and mentors are there to help you do it. Let's start to map out a way that you can bring yourself and your skills to it. So let's fill in that gap between what you've sat through in lectures, what you're going to experience on the ward, and how you can take a system in to help your learning from all of the professionals who are there to get you up and running. Let's fill the gap by talking about your nervous system and how it already knows the pressure and it already knows the volume of information you've got to take in, and it knows that you've got several things you've got to get figured out. So when you see these patterns, you're going to start working with them as a regular part of solving a really straightforward or a very difficult puzzle, and you're going to carry on and not feel lost, but you'll have the tools to get there. Frame your relationship with fluids as I can find the patterns and I'll put them in place so that I'm not overwhelmed. If you've been on a ward and nurses have sat you down and said, here's the type of fluid, here's how it's going to function, here's how this patient is affected by this fluid right now, this is what's going to happen to their heart, to their kidneys, their blood pressure, and how we can now see it on the chart all in one time. Oh, how good is that going to be? Many days might be so busy that's not what happens, but take the time to prepare for it in advance. Let's start working through it step by step so that you can see why the heart failure patient went from just a bit puffed to a Met call when 3 bags were hung. We're going to do that across this module. Part of that work means naming a lot of the pressures that you're under. Clinical placements are not just about learning skills, they're about surviving rosters, navigating personalities, dealing with your own finances, supporting your family, absorbing, confronting stories of illness and death. All of these things are there while you're working with your patients. Many of you are also commuting long distances. You're working part-time jobs on top of it. You're carrying cultural and family expectations and responsibilities on top of your studies. So when you arrive onto a ward, you're not just a blank slate. You are someone with something, and now you're experiencing a new environment that you bring yourself into. You might already be tired, worried, you might be stretched before you've even put on your uniform, and then you're being asked to step in where staff is short, acuity is high, and the hidden rule is don't complain, just cope. In that context, it's completely reasonable that your attention narrows to getting through the task list. Just focus on it. Give the meds, do the ops, fill the charts. Keep everyone happy. When your brain is in survival mode, it's not really prioritizing a deep understanding. It's prioritizing not getting shouted at and not feeling bad about yourself. So you do what you're told, hang the fluids, scribble in the chart, and respond when someone calls. Now, I don't know why we're giving fluids may come into your mind. That's part of the learning curve. I'm going to just trust the order. You might think that as well. These are signs of the pressure around you. Recognize them, accept them, and work through them. Because at the end of the day, when you think those things, it doesn't mean you've lost any care. It means that your conscious state is under siege. Your cognitive load is being strained and stressed. Your body's tired, your brain is loaded, your emotions, your energy, oh my. Under those conditions, of course, fluids feel hard. Just dealing with fluids, nothing else on the ward, it feels hard. Maybe the patterns don't stick directly at the beginning, but when you go home and you feel overwhelmed, when you're feeling it, that's not necessarily a reflective state that you want to be in, but take some time to just relax and let everything absorb in so that you can take the information and start to synthesize it. Uh, your overwhelm is information. It's not a verdict. Look at the information and help figure out the story. So all of the teaching behind fluids doesn't quite line up. Once you're on the ward, it will begin to line up. In fact, it's going to line up how the human nervous system actually learns under load. You'll find that your learning on the ward has a completely different dynamic to studying in a book. More on that at a different time. Uh, what we want to do now is redraw some of this content. We want to look at One moment. I am, oh, I am, hold it. Okay, pardon me, bit of a sneeze. Okay, we want to redraw the content and how it's looked at and how you can use it in your self-management. Okay, how you feed yourself, how you rest yourself, how you regulate your mind, and look at your cognitive capacity. Well, that's going to be how you deal with complex topics such as fluids. I'm really trying not to sneeze. Okay. Just because we're putting together this system, it doesn't mean you're not going to miss an entry on your chart. I'm not saying you're going to be the perfect, and I'm not saying that you'll have to fill something in later when things calm down. That would be silly for me to say. But start to identify your success so that when you walk into a room, your eyes automatically doing a scan without even having to think of it. What's running on the pole? How fast is it running? What condition is the patient in? What do their ankles look like? What's their breathing like? Does their face tell me anything about their fluid state? Glance at the chart and quickly tell whether it's roughly up to date or if there are big gaps. And if something doesn't add up, be confident enough to go and say, can we check this fluid plan? Or I'm concerned about the positive balance and these crackles. You'll know which questions to ask and when to escalate. This is where you're going towards, and this is where you will get to as you start to increase your confidence. Now, success also means that you have a small, realistic system for your practice. That scan we've talked about, perhaps working in your mind conversations. What happens if a family is asking you why about the fluids? You'll start to put together systems that work for your practice so that you can go to a very effective default. You may start to check fluid charts at the same time you do observations. So you don't have to rely on your memory at the end of the shift. Just take it all in at the same time. Maybe you have a personal rule that you'll never hang a new bag without mentally asking, how are this person's heart and kidneys going to cope with this? Maybe you have a notebook where you jot down some confusing fluid cases and you want to unpack them later. Jot down the notes so you can look later. Don't carry all of that with you as you work. Take it down and get a quiet time later to look at your notes. Now, these are tiny things that build up a structural cohesion for your practice, and they make it more likely that you can spot problems early, even when you're very busy, because your system is in place. Also, take a little different shift about how you think of yourself and your learnings. Don't berate yourself for not knowing everything. Start to say there's a reason it feels hard, and I'm working through the learning process. You're going to see that confusion is a temporary state, but it's on the run, and as you get into the context of learning, everything begins to sit more firmly within the patterns, the ebb, the flow, and the high degree of activity on the ward. You recognize that as you get clearer about fluids, you're also becoming safer, not just for yourself, but for your patients. And that's a big goal. You want to be able to understand and know the facts, but most importantly, you want to build the patterns and the systems that support your safety and your patient's safety. Coming up, we want to start dismantling some of the dangerous myths about fluids and fluid charts. We're going to talk about why just fill it in later, or just follow the order, or it's only saline are very seductive phrases, but they are also very harmful if they are used in the wrong way. We're going to take how those stories go and begin to test ways about what it means to be a good student, a good nurse, and how you will then work with fluids. For now, just take a breath. Uh, we've looked at a near miss. We've looked at your cognitive load. We've looked at overwhelm and how we work through it towards being more oriented in your practice. That means you're becoming a much safer nurse, a more reflective clinician. Fluids are a powerful thing. You're absolutely capable of learning it, and you'll be able to navigate through the fluids with all of your other duties as we continue through.